My name is Donna Edwards, and today we'll be discussing clinical issues in intensive outpatient treatment for substance use disorders. Intensive outpatient programs, IOPs, for substance use disorders offer services to clients seeking primary treatment, step-down care from inpatient residential and withdrawal management settings, or step-up treatment from individual or group outpatient treatment. IOP treatment includes a pre-arranged schedule of core services. Example given: individual counseling, group therapy, family psychoeducation, and case management services for a minimum of 9 hours per week for adults or 6 hours per week for adolescents. To help clients fulfill their individualized treatment plan goals, IOP services may incorporate other in-house treatments and peer services, encourage clients' attendance at multi-support groups, and collaborate with local community providers to secure needed services. Example given: medicated assisted treatment, psychological assessments, vocational rehabilitation services, and trauma-specific treatment. Key messages: IOP outcomes are comparable to those seen with residential services for clients with minimal risk of acute intoxication or withdrawal, health conditions, and psychological symptoms. IOP programs provide clients with local comprehensive SUD treatment services and access to other social services in the community, thereby establishing and building a recovery network that can extend beyond treatment. Key IOP programs features improve treatment engagement, retention, and outcomes, including shared decision-making, mutual support, and recovery activities, case management, and vocational support. IOP treatment is most effective if it is part of a continuum of care. Here are some advantages of IOP treatment. The 2019 National Survey of Substance Abuse Treatment Services reports that 46% of SUD treatment facilities after IOP treatment. IOP programs offer advantages over residential settings and standard outpatient services through in treatment delivery. Because IOP programs offer day, evening, and weekend programming, clients can maintain responsibilities outside of treatment, including work, caregiving, parenting, and education. Less restrictive comprehensive treatment. IOP programs offer more intensive services than traditional outpatient, while avoiding the restrictions of residential treatment. IOP treatment provides services over a longer period than most residential treatment. IOP services are local, making them less disruptive for clients to manage day-to-day responsibilities. Continuity of care and support. Clients engaged in IOP treatment often use local community services and multi-support groups outside the program. After completion of IOP treatment, these support networks and services remain intact, easing clients' transition into the next phase of recovery. Transitions from residential to outpatient treatments often require time to create or reestablish a network of services and support. Real-time skills training. IOP programs provide opportunities to practice recovery skills in real time. Because treatment occurs locally, clients can apply newly required skills with family and friends and in other circumstances while still engaged in treatment. By practicing those recovery strategies, clients can build self-confidence, a key attribute to making behavioral changes. Here is an overview of IOP services. IOP placement criteria. IOP treatment involves comprehensive outpatient services that meet the needs of those with substance use and co-occurring disorders. A comprehensive multidimensional assessment of presenting problems, treatment goals, and recovery needs guides the level of care determination. Clients suitable for the IOP level of care are characterized by the following. There is little risk of acute intoxication or withdrawal. Physical harm conditions are manageable and will not distract from treatment participation. Emotional, behavioral, and cognitive conditions are mild or treatable on an outpatient level, but may have the potential to distract from treatment and recovery and therefore require monitoring. Readiness to change fluctuates, highlighting the need for engagement in a structured treatment environment several times a week. There is a greater probability of continued use, problems, and relapse without support and monitoring throughout the week. Current environment is not supportive, but added support and structure from an IOP program enables coping. If clients are appropriately placed in an IOP treatment outcomes are comparable to inpatient treatment, but at nearly half the cost. IOP treatment goals. In addition to individualized treatment goals that reflect the client's strengths, recovery, challenges, and presenting problems, IOP services characteristically focus on the following objectives: educating clients about SUDs, patterns and consequences of use, relapse risk, the treatment process, and types of multi-support groups, providing early recovery, coping and relapse prevention skills, building recovery supports, including the use of peer support services and multi-support groups, addressing obstacles to engaging in treatment and maintaining recovery, providing physical and psychological symptoms management by monitoring and addressing the symptoms or referring the client as indicated. Engaging families as defined by the clients and providing education on SUDs, patterns and consequences of use, family dynamics, and treatments and recovery processes, providing emotional support and enhancing motivation, attending to other health and psychosocial needs, including housing, vocational, financial assistance, and other medical and dental needs. IOP services. SUD IOP programs provide a range of services, schedules, hours, and lengths of care. IOP treatment requirements vary across states and health plans, but generally involve a minimum of 9 hours of client services each week at local facilities. Online synchronous IOP programming and telehealth appointments have steadily evolved to bolster existing services and meet the needs of individuals living in rural regions. Recently, many IOP programs have transitioned to telehealth models to service delivery in response to the COVID-19 public health emergency. According to the 2017 treatment episode data set on IOP program discharges, the median length of stay for those ages 18 years and older who completed treatment is 81 days. Individual counseling. Individual counseling typically occurs once a week or as needed. Sessions focus on addressing problems that need more attention or issues that clients are reluctant to raise in group format. Individual counseling services provide an opportunity to check in with the clients to address their concerns in the program, provide additional support, and further enhance readiness for change and motivation to support recovery. Case management. Case management services involve a collaborative between the client and case manager to determine and coordinate access to the most suitable services for supporting the client. Example given: medical, SUD treatment, behavioral health, and social services. Commission for case manager certification. Though each IOP program may define case management roles and tasks differently, here are several core case management responsibilities. Assessing and developing individualized plans with the client. Coordinating and referring clients to the most appropriate service in-house or within the community. Monitoring clients' follow-through with services and support systems, as well as their outcomes. Advocating for the client within treatments and with community agencies to establish and arrange needed services. Example given: housing, primary care services, financial assistance, and vocational services. Also, promoting and establishing continuity of services when clients transition from one service to another to avoid service gaps. Case management in SUD treatments improves clients' follow-through with treatment tasks and retention in services, and subsequently improves treatment outcomes. Group counseling and activities. IOP programs use group counseling and activities as the primary treatment modality. Group sessions are divided among psychoeducation, skill sessions, or process groups. Some programs offer group psychoeducation for families or multifamily group therapy. For more information, you can see Tip 41, the Advisory Group and Therapy Substance Use Treatment. A sample of psychoeducational and skill-oriented groups is as follows. Early recovery skills, readiness, stages of change and motivation, living with chronic conditions, family dynamics of addiction, relapse prevention, 12-step facilitation, mindfulness-based relapse prevention, assertiveness and refusal skills, consequences of addiction, physical, emotional, and cognitive, problem-solving skills, cognitive skills, and analysis of behavioral patterns. An example of an off-hour client's communication. A 34-year-old female attended an IOP group evening session, then returned home to find her spouse drinking heavily. She called her IOP program to report that her husband was drinking, became agitated, and yelled, "You ruined our relationship. Why don't you drink? If I don't have a problem, you sure don't. I even brought your favorite beer. You act like you are better than me." She left the house not knowing what to do. She did not feel physically threatened, but was afraid that she would relapse. During the call, she reviewed her motivation for recovery, decided to stay overnight at her brother's home, and agreed to follow up with her case manager to evaluate the appropriateness of family counseling. 24-hour crisis services. IOP programs have crisis intervention policies and procedures to address emergencies outside of the program hours. Example given: suicidality, psychological distress, relapse risk, safety issues. Clients with SUD may face unique challenges such as receiving treatment while still negotiating responsibilities, relationships, and living and/or working in environments associated with their substance misuse. Crisis intervention are cost-effective, help prevent hospitalizations, and ensure the use of the least restrictive treatment options. IOP programs and other behavioral health care providers have promoted the use of warm lines after hours for those not in acute crisis but in need of support to prevent relapse or to de-escalate a stressful circumstance. Warm lines, staffed by peer recovery workers, provide support, resources, follow-up, and weekly check-ins as needed. Services. Addressing family issues helps to secure a healthier recovery environment. IOP services offer family psychoeducational groups and family counseling. Family session goals include educating family members about SUDs and treatment, addressing family dynamics to reinforce a supportive recovery environment, and assisting family members in committing to their own wellness. Other services. IOP programs may offer other services in-house or through coordinated referrals such as medication-assisted treatment, alcohol and drug monitoring, psychological or psychiatric assessments and services, peer services, licensed child care services, transportation, wellness programs such as yoga and nutrition, medical services, vocational or educational services, and co-occurring enhancement groups. Here is a sample of an IOP program. Evenings 5:30 to 7, Monday check-in and process group, Tuesday multifamily educational sessions, clients and family members attend. On Wednesdays, early recovery skills and practice groups. Thursday, psychoeducation substances, consequences, and recovery. Then a break for about 15 minutes, and then it would commence to 12-step facilitation, group and peer support, service orientation, and check-ins. And then on Wednesday, motivational cognitive behavioral group. Thursday, mindfulness-based relapse and prevention, and weekend planning. So assessments, individual family counseling, and case management sessions are by appointment on Tuesday evenings and 8 a.m. to 5:30 p.m. during the week. IOP settings and populations. IOP programs differ in location, services, and programming. For example, there are hospital-based programs to which clients are referred after withdrawal management and community-based programs used to step down services after SUD residential treatment. Co-occurring enhanced IOP programs offer access to psychiatric services and specific programming to address co-occurring mental disorders. Examples given: depression and post-traumatic stress disorder. IOP programs may specifically serve those who are receiving medications for opiate use disorder, women who are pregnant, veterans, and specific age group. Example given: adolescents, young adults, or older individuals. SUD IOP programs may provide services to those mandated to treatment by the criminal justice system, for example, for driving while intoxicated. Programs may also serve individuals transitioning from incarceration back to their community or those who agree to attend IOP treatment in lieu of serving out their remaining sentence. One study evaluated IOP treatment retention among court-mandated clients demonstrated that those who were court-ordered to IOP programs were more than 10 times more likely to complete treatment than those who attended voluntarily. Engagement, retention, and outcomes in IOP treatment. Although IOP programs are a common modality in SUD treatment, IOP-specific research is limited, especially in the last 20 years. Only a few studies examine individual factors that enhance client engagement, retention, and outcomes in outpatient treatment settings. For example, Program satisfaction may lead to greater investment in treatment, continuing care, and recovery. Eliciting clients' feedback throughout treatments may improve outcomes by altering providers of dissatisfaction and the need for treatment plan modification. Research demonstrates that greater client satisfaction with treatments leads to higher retention rates in outpatient services at 3 months. IOP programs that educate and reinforce the use of multi-support and recovery activities may improve clients' outcomes. In a multi-site study across treatment modalities, clients who engage in treatment and participate in multi-support groups had less substance misuse. IOP programs should not be the sole approach for any client. Instead, they need to be one step along the continuum of care, moving from more to less intensive treatments on the continuum of care improves client outcomes in general. Clients' level of functioning, recovery resource and supports, and relapse risk factors should guide overall planning and next step immediately after IOP treatment's completion. Clients who experience improvements in employment status during treatment, example given, decreased absenteeism of new full-time employment or increased length of employment, are more likely to complete treatment and remain abstinent. IOP programs that focus on treatment goals specific to employment and incorporate vocational support and access to vocational services may improve long-term recovery outcomes. For more information, see Tip 38, Advisory, Integrating Vocational Services into Substance Use Disorder Treatment. Clients' preferences and involvement in decision-making regarding treatment options are significant ingredients to improving treatment engagement and outcomes. Studies demonstrate that clients who were involved in shared decision-making were able to choose a treatment modality or receive their preferred treatment had greater treatment satisfaction, higher retention and completion rates, and better outcomes.